Hi everyone, welcome to Thymus. We're your med school advisors
and personalized study buddy.
Today's lecture is going to build your basics on one of the most important yet confusing topics in pharmacology, ANS, or the autonomic nervous system. The autonomic nervous system is the major pathway for transmission of information from the central nervous system to the involuntary effector tissues. This video is going to focus on its two major subdivisions, the sympathetic system and the parasympathetic system. Systems at each level. So let's start. The source of the sympathetic system is from the thoracic as well as the lumbar segments of the spinal cord. Whereas, if you notice, the parasympathetic system originates from the cranial nerve nuclei of the 3rd, 7th, 9th, and the 10th cranial nerve. It also originates from the sacral segments, usually S2 to S4 of the spinal cord. Moving on to the neurotransmitters that play a predominant role in each system. The sympathetic system has presynaptic fibers that release acetylcholine. The presynaptic fibers of the parasympathetic system also release acetylcholine. The postsynaptic fibers of the sympathetic system release norepinephrine, predominantly and sometimes epinephrine. Remember, however, the important exceptions to this rule. The sweat glands, as well as the sympathetic fibers to skeletal muscles, release acetylcholine, not norepinephrine. The postsynaptic fibers of the parasympathetic system release acetylcholine, just as the presynaptic fibers do. Now you may be wondering, what is the meaning of presynaptic fibers or postsynaptic fibers? It really confused me. Allow me to explain. This is a synapse. The fibers from the spinal cord, or well, in this case, the brainstem leading up to the synapse, are the presynaptic fibers. The fibers that originate from the synapse to the effector are the postsynaptic fibers. Notice that all the presynaptic fibers release acetylcholine at the nerve endings, but the postsynaptic fibers don't, they differ. In the parasympathetic system, the postsynaptic fibers release acetylcholine, whereas, as we discussed, in the sympathetic system, they release norepinephrine. Notice the exception, the sweat glands, where again, although it is a sympathetic innervation, the postsynaptic fibers release acetylcholine. You're probably wondering what this M and these alpha and beta stand for. Well, these are the receptors that receive the neurotransmitters from the postsynaptic fibers. The major receptor system present in the ANS includes the adrenoreceptors and the cholinergic receptors. The adrenoreceptors are the receptors present in the sympathetic nervous system, and these comprise the alpha, beta, and the dopamine receptors. The cholinergic receptors are comprised of two types of receptors, the muscarinic receptors and the nicotinic receptors. This is a table from Cats in Pharmacology. Unfortunately, you have to memorize the location, the mechanism of action, and the major functions of each receptor in ANS. I know firsthand how difficult it seems, so hopefully I can help you orient yourself better. Keep in mind that although concise, this is a very high-yield table, therefore I strongly urge you to memorize this well. Starting off, notice that all adrenoreceptors are G-coupled proteins, and therefore their actions differ based on the type of the G protein. I'll start with the exceptions. The alpha-1 receptor is a GQ protein. It causes increased IP3 and DAG and therefore causes increased calcium levels. Since its effector tissues include smooth muscle and glands, it causes increased contraction and secretion. You'll notice that all of the receptors have the CAMP second messenger system, except for alpha-1. Moving on to the alpha-2 receptor. This is very important because this is the G inhibitory protein. Therefore, it decreases CAMP. Since its location is mostly nerve endings and smooth muscles, it decreases transmitter release at the nerves. However, it does cause smooth muscle contraction. You'll learn more about this in the next video. Moving on to the beta receptors. The beta-1 and the beta-2 receptors are present in the heart. As you can see over here, they both increase the heart rate and the force of contraction. Remember, only the beta-1 receptor is present in the juxtaglomerular apparatus in the kidney. Therefore, it increases renin release. The beta-2 receptor, on the flip side, is present in the liver. It therefore causes increased glycogenolysis. It is also present in the smooth muscle. However, notice that it causes relaxation of the smooth muscle, which is completely opposite to alpha 2 receptor, which causes contraction of the smooth muscle, as well as the alpha 1 receptor. The beta 3 receptor is present in adipose cells. It causes increased lipolysis. And lastly, the dopamine receptor is present in smooth muscles, but only those of the renal vasculature. Let's discuss the cholinereceptors. We have two types of cholinereceptors, which are the muscarinic and the nicotinic receptors. The muscarinic receptors respond to muscarine, which is an alkaloid, as well as to acetylcholine. The nicotinic receptors, as made evident by their name, respond to nicotine and acetylcholine. Starting with the muscarinic receptors, we're discussing M1, M2, and M3 over here. There are more, but let's focus on these for now. Let's start with the exception again. M2, this is GI coupled, so this is G inhibitory. Recall that in adrenoreceptors, the inhibitory G coupled protein was alpha 2. So remember this, M2 for the cholinereceptors, alpha 2 for the adrenoreceptors. Both of those are inhibitory in nature. They will decrease CAM. On the flip side, M1 and M3 are both GQ proteins. Recall from adrenoreceptors that alpha 1 receptor was a GQ protein. So the M1 receptors are present in the CNS nerve endings. The M2 is predominantly in the heart. The M3 are found in the effector cells such as in smooth muscle, glands, endothelium. Now moving on to the nicotinic receptors. These are of two types, the N-type and the M-type. The N-type are present in the ANS ganglia, and the M-type are present in neuromuscular end plate. M should remind you of muscular. They both have the same mechanism of action, and these are different from the other receptors. Both of these are basically present on the sodium-potassium ion channels, and we know how those work. Depolarization occurs, they evoke an action potential. And that's our quick intro to ANS pharmacology. Thank you for watching. What would you like us to cover next? Comment down below. And please don't forget to like and subscribe.